My name is Piero, and this is our company, People. At People, we are how health facilities and developers connect to make medical devices cheaper and scalable. The average total cost for startups to bring a low-risk medical device from concept to FDA clearance is over $30 million. In addition to this, even when you invest a lot of money, distribution and production costs covers almost 75% of the total price of the medical device, leaving companies with a little margin to recover investment in short times. This very complex environment makes that medical industry becomes a risky and tough journey for investors as well as for startup companies. In fact, regulatory submissions for innovative new medical devices have been declining and reducing in the US over the last several years. Therefore, the medical device industry has many market barriers, such as the fact that it requires too much investment of money and time, has extensive regulatory pathways, is difficult to scale in, and consequently too risky for investors, for which ultimately leads to unaffordable devices for patients. This is the chain value of a medical device from conception to market, in which the high risk and the amount of money lead to a product in which price exceeds value. So no matter how good the product is, if no patient nor the health facility can afford it. So, how can we solve the high prices and risk in this industry? As People, we are developing the solution as a single decentralized production and distribution channel that allows early developers to quickly offer their products and thus connect with physicians. This solution will change the way we look at manufacturers, distribution models, and the chain value of a medical device, thanks to a network of 3D printers connected to an online marketplace allocated in health facilities. By making this possible, we not only reduce production, payroll, and transportation costs, but we reduce the risks and execution times of startups, so finally price will meet value. We work as a marketplace in which, on one hand, developers can upload the plans of their products to offer them within our network of printers. And on the other hand, health centers pay unitarily for each device they need. In this transaction, we keep 20% of the price. The benefits of this model are increases scalability for developers and reduces costs of acquisition in hospital, it protects the intellectual property, decreases production and distribution costs, and accelerates time to market. Currently, there is a gap in the market with only two types of profiles. First, the companies that work in research stages to make sophisticated materials and devices, and on the other hand, those that provide the decentralization of manufacturing through 3D printing marketplaces. These 7 companies here have reached a valuation of more than $4 billion. People&CO seeks to be the first startup that mixes bonus initiatives, connect the best of simplicity in last-mile digital manufacturing with the quality of medical devices. In our market, we are able to earn revenues of $300 per device in more than 26,000 hospitals in America, with a demand of more than 1,000 units per year, leading to an annual addressable market of $8 billion. Likewise, the 3D printed medical device industry is growing at a rate of 36% each year within a market that will be worth $200 billion by 2026. Our go-to-market strategy is made up of 2 approaches. The first is to start with devices with less restrictive regulatory barriers, and the second is be able to reduce the acquisition cost due to our business model. Thus, our objectives within the first year are focused on, first, starting an iterative process of proof of concept that will allow us to enter the ecosystem and develop our product, and 2, the formation of our advisory board, a pricing round, and the formation of partnerships for the adoption of our product. By 2023, the goal is traction, so we'll migrate to a country with high health surveillance. The team will grow and we will refine the company's operating model. For the following years, we expect sustained growth and increasing the frequency of purchases with a larger portfolio of devices and closing a seed round that will allow us to openly launch the marketplace and enter more sophisticated markets. We are the People team made up of 2 AI engineers and a programmer with an excellent academic and professional background in the software and medical technology industry. Thanks for hearing us. We are People.